Hey everyone, Wausau Mayor Katie Rosenberg here with the amazing Marathon County Public Health Department, Laura Scudiere. I'm sorry, I was winding up for something.
I know, it's really exciting.
You're our health officer. Thank you for doing this crazy job.
Oh, thank you for having me. Pleasure to serve.
Yeah, so we're here with our three things. And I think the obvious question is what it's the 15th letter of the Greek alphabet. Omicron, also the new variant.
Yep.
What is it? What should I know about it? Give me the nuts and bolts of this thing. What's going on here?
Yeah, Omicron's a variant. So it's interesting because Katie, it was briefly considered, like they considered whether or not to name it new and you. But they decided that that's really confusing. And then briefly they were thinking, well, maybe it should be, and I might not be pronouncing this right, XI. And
sure.
The problem is that is a really common last name.
Yeah.
So then it landed on Omicron.
I mean, she's Xi Jinping, right? Like right there.
Yeah, so done.
Anyway.
So instead there's less people. I'm sure there are people who are named Omicron, but
Google that one. Yeah.
Maybe, yeah, I don't know. But so the big variant that we have had in Wisconsin has been Delta. And what happens now is that when any time that especially in places where the virus can get out and move along, especially unvaccinated individuals, it has the opportunity to mutate. And so Omicron is the next version of COVID. So it's the next variant of concern. And we are concerned about it. And we're concerned about it because there's a possibility that it may transmit more easily between people.
Yeah. That's what I've been seeing, at least in the national coverage, is that's one of the things about it. What else about it should we know?
Well, we don't really know much yet. And so like we know of it, we know pieces of it that are mutated on the genomic sequence of it, but we don't really know much about it in general yet. Like what is it really going to look like? But they do think that that there is a chance that the vaccines will be effective against it. That it's unlikely. That
was my next question. So you do know that vaccines do seem to be effective against it.
Well, we think that it will be, and we don't know for sure, I should say that, but we think it's unlikely that it won't be completely resistant to the vaccines that we have been circulating. So we're hopeful, and Katie, as we know more, we can talk about this, but it's kind of a developing situation.
Mm-hmm. I'm going back in time to my Science, Society, and Global Threats class that I took in college. And one of the things that we talked a lot about was that kind of multi-drug resistant MRSA strain that kind of isn't, and I know this is completely different, but that's the concern, is that if you end up having something that mutates so much that it's resistant to vaccine or treatment, I mean, it becomes a little bit more difficult to deal with and unwieldy.
Yeah, we don't want, the more people that get vaccinated and protect themselves against transmission, that it will help us control the disease so that it has less opportunity to mutate. So I want Omicron to be the last variant. Let's make it the last one. I don't want to know any more of the Greek alphabet.
I don't want Lambda. I don't want Omega. I don't want Mu.
No, we're done. This is the worst sorority name.
It's the worst
that I've ever been a part of. Yeah.
Oh my gosh. Okay, so I'm ready. So get vaccinated, stop this thing from mutating and traveling around the world. Stay home if you're sick, wear a mask in public places. All of the same advice is still really good advice to follow.
Yep.
I'm here for it. Okay. So I have a question now about like detection. So we have a lot of availability when it comes to those kind of rapid tests or at-home tests. But one of the questions that keeps coming up are they as good as the ones that you go to the hospital and they stick it way up your nose, PCR variety?
Sure. Well, so they're different. So we call the rapid tests are antigen tests. So they're really looking for antigens, and what it means is when you get a test like that, it's looking for the chance that you have the virus. So ideally, if it finds antigen, the probability is you've got it, right? So they are less sensitive than PCR, but it really is, they're really a good tool to have. So if you can locate, like if you're at Walgreens and you see one and you know that and it's within your price range, you know, and it makes sense for you, go ahead and get it, because they're really good at being able to be a 15-minute check. So think of it as like a pregnancy test for COVID. The thing that I want to tell people though, Katie, is that if you take a rapid test, so basically what it is, you swab your own nose and you put it in this card and you put some fluid in it, not necessarily in that order, and it will tell you with one line or two whether or not you're positive for COVID-19. The thing I want to tell you, Katie, is that if you take the test and you have symptoms, and you get a negative test, you probably should get the gold standard test, which is go to your healthcare provider and get what's called a PCR. So basically, if you're surprised by the result, you should probably get another test. So like if I have symptoms and I take the rapid and it says negative, I'm still going to want to probably take another test. Same thing is if I don't have symptoms and I come up positive, I also probably want to take another test just to make sure. That's what's recommended right now. It's not required, but it's recommended.
Okay. So when you talk about it, the pregnancy test of COVID, you're saying that if you have suspicions, you should still have your doctor check it out for you. So that makes sense.
Yep. If in those certain circumstances, if you're symptomatic and you take the test and it's positive, it's kind of telling you like, yep, that's what's happening. You don't necessarily need to get a confirmation.
Sure.
You can just stay
yourself,
home,
do all the stuff, contact anyone that was maybe close to you.
Right.
Okay.
Katie, I can mention that we do have rapid testing that is provided by the UW in Wausau every Thursday from 8 to 4 at 620 South 7th Avenue. And then we also work with the National Guard to provide testing on Thursdays from 9 to 5 at Eastgate Hall. So, both of those places have PCR tests, but the UW has the rapid test. So you'll know your results within 15 minutes, which is real nice.
I will say I did go to the rapid test site. It was very quick, easy, not stressful at all. The good news about most people is they won't have the media there taking a picture of them sticking something up their nose. So you shouldn't be embarrassed at all. I've done that for you.
Thanks for taking that for the rest of us.
No problem.
The bottom of your nose, right? They didn't go.
Yeah. Oh yeah, it was super easy. It was just having a camera in your face while you're doing it is awkward. Yeah, I see your eyes. I did that. Okay, well, as always, thank you so much for all of your information. I hope that one of these days we are talking about stuff that's not COVID related. I have so many public health questions waiting in the wings for when this pandemic is over.
Yeah, I can't wait to have that. So let's hope that Omicron does not turn into a bigger surge than what we're experiencing right now, and stay safe, everybody.